How's it going, YouTube? Dr. Freeman here from Freeman Chiropractic Wellness, and today we're going to talk about medial epicondylitis, better known as golfer's elbow. If you tuned in last week, this is going to sound pretty familiar because we talked about tennis elbow, which deals with pain on the lateral side of the elbow. Today we're talking about golfer's elbow, which is very similar, but it actually deals with pain on the medial side of the elbow. So if you did tune in last week, we're going to talk about a few different techniques and you're going to learn a few new tools to deal with your elbow pain. Now, before we dive too far in, I want to mention that our clinic is running a promotion for the month of December. We're writing off new patient exam fees, which leads to about $80 in savings. If you're in Ithaca and you want to learn a little bit more, check the description down below. We're going to leave details about the promotion as well as ways to reach out to us. Now let's get back into the content. So golfer's elbow. What is it, who gets it, and what can we do to prevent it or treat it if it's already ongoing? Well, much like tennis elbow, golfer's elbow occurs due to an overuse of certain forearm muscles, not due to an injury to the elbow joint itself. These muscles that we're interested in for golfer's elbow are all responsible for flexing either the wrist or the fingers. For your reference, I'm going to put pictures up on screen now of both wrist flexion and wrist extension. We're going to be referencing these terms a lot, so feel free to pause and familiarize yourself with these pictures or jump back to this part of the video if you ever get confused. Essentially, what's going on with golfer's elbow is an overuse of our flexor muscles relative to our extensors. Now, you don't have to play golf to get golfer's elbow. It is one possible cause, but a lot of people get golfer's elbow whether they play golf or not. Now, it's not just that we're using these muscles too much overall, it's that we're using them too much relative to our extensors. So if you happen to be a golfer, a rock climber, or you participate in any other activity that might have you overusing these muscles, it's important to stretch your flexor muscles and strengthen your extensor muscles to maintain balance in the elbow and avoid that sharp pain. Now that we understand what's going on a little better, let's jump into a few methods to either treat or prevent golfer's elbow. We're going to use a very similar 3 methods for golfer's elbow that we used for tennis elbow last week. This is because these 3 methods can be applied to a lot of different conditions. They're extremely effective, easy to learn, and can be performed at home for significant relief. The first method that we're going to employ is a simple static stretch for our flexor muscles. Now to perform this, we want to have our arm out in front of us. We're going to take our other hand, grip the fingers, and gently pull back until we feel a stretch in our forearm flexors. For reference, those are right here. This is where you should be feeling a little bit of a pull. So again, we're going to grip, gently pull back until we feel a stretch, and you're going to hold this position for about 45 seconds to a minute, 3 to 5 times per day to keep these muscles nice and loose. Now, a lot of us only get symptoms in one elbow, but if you happen to be coming from a sport like rock climbing that tends to cause issues on both sides, then you can stretch both arms at the same time. You can do this by kneeling, placing your palms on the ground with your fingers facing back towards you, and shifting your body weight back slightly until you start to feel a stretch in the same area that we just discussed. Again, you're going to want to hold for about 45 seconds to a minute, 3 to 5 times per day to help loosen those muscles up and keep them loose and avoid that pain. The next method that we're going to employ is called pin and stretch. This is a more dynamic option for loosening up the forearm flexors, and it works really well in combination with the static stretch that we just discussed. I'm going to shift slightly so that I can demonstrate while we talk through this. So what you're going to want to do is hold your arm out in front of you, and you're going to hold your wrist in full flexion to start, as well as your fingers in full flexion, so you're going to make a fist. With the opposite hand, you're going to grip your forearm so that your thumb is on that flexor side, that's the palmar side of your forearm. You're going to press in with your thumb with moderate pressure, and then shift slightly towards the elbow. Holding that moderate pressure, you're going to open up your fingers and slowly extend your wrist until you feel a nice stretch in those forearm flexors. Hold for just a second, release pressure with that opposite hand, reset into full flexion, and repeat. You're going to repeat this for about 10 repetitions once per day in combination with that static stretch that we already talked about, and that's going to help loosen up those muscles even further. So now that we're making progress towards loosening up those flexor muscles, the next piece of the puzzle is to strengthen the extensor muscles to further increase that balance in the elbow and reduce that elbow pain. Just like last week, we're going to employ a simple exercise called a wrist curl, but this time we're going to use a reverse wrist curl. Again, you're going to want a light dumbbell or something similar like a can of soup, a water bottle, whatever you have access to at home should work fine. You just want a little bit of weight. You're going to start in a seated position with your elbow supported and your palm facing down. Your wrist should be slightly in flexion, and when you start the exercise, you're going to contract your extensor muscles by bringing that wrist up into extension. You're going to contract until you're as far as you can go into extension, hold for just a second, and then relax, slowly bringing that weight back down into flexion. Now your rep range is going to depend on a couple of things. That's how much weight you're using and how difficult you find each rep. I like to use an amount of weight that allows me to do 10 to 12 reps, where the last couple of reps are difficult but not painful. So you can play around a little bit with the weight and see what works best for you. Regardless of what you choose, you're going to rest for about a minute after your set, and then repeat for 2 more sets, a total of 3 sets, 3 times per week, and that should help strengthen those extensor muscles over time. Remember, as you're doing this, your extensors are going to be getting stronger. That means whatever weight you're using might be easier a month from now than it is today. So remember to either increase your reps or increase your weight over time to try to maintain that difficulty for the last couple of reps and ensure that you're continuing to make progress. And that's it. Now you've got 3 great tools in your belt to help combat golfer's elbow. Whether you're a long-time sufferer or you're just trying a new sport and you want to avoid that pesky elbow pain, you can now move forward with confidence. If you enjoyed today's video, please leave us a like and let us know in the comments section down below which exercise you found the most helpful. And be sure to subscribe for future content coming soon. Have a fantastic week, and we'll see you next time.